thank you so much for being here for our first annual Gold Foundation Humanism in Medicine event. I'm glad to welcome all of you to Murphy Auditorium at Iona College, and most specifically, I'm happy to welcome Dr. Brook and his wife to Iona, so welcome and thank you for being here with us this evening. Dr. Brook is a professor of pediatrics at Georgetown University. He is the past chairman of the Anti-Infective Drug Advisory Committee of the FDA. He's done extensive research on anaerobic and respiratory tract infections, anthrax, and infections following exposure to ionizing radiation. He's the author of 6 medical textbooks, 128 book chapters, over 700 scientific publications. He's an editor, associate editor, and member of the editorial board of several medical journals and the Head and Neck Cancer Alliance. Dr. Brook is the recipient of the 2012 J. Conley Medical Ethics Award by the American Academy of Otolaryngology, Head and Neck Surgery. He's the author of the books, My Voice, A Physician's Personal Experience with Throat Cancer, and In the Sands of Sinai, A Physician's Account of the Yom Kippur War. Tonight, he's here to kick off our inaugural Humanism in Medicine event, graciously sponsored by the Arnold P. Gold Foundation. We are honored to welcome Dr. Brook and his wife to Iona College. Please join me in welcoming Dr. Brook.
Good evening. It's a pleasure to be here tonight and address you on the topic of speaking, the challenges of speaking after laryngectomy. You are all students or teachers of speech pathology, and speech pathology is essential in learning, gaining the ability to speak. After laryngectomy, I became a laryngectomy 6.5 years ago after my throat cancer recurred, and I was exposed to a new, unexpected world, where my ability to speak was not the same. Losing the vocal cord is a tremendous loss and a tremendous challenge. And speech pathologists were part of the team that brought me back to speaking again, and in many ways brought me back to fruitful and useful life. So what I plan to do tonight is speak to you about my personal experiences, but also about what it is to become a laryngectomy and suffering from head and neck cancer, and what challenges one has in regaining the ability to speak and finding a meaningful life. I want you to understand that speaking is only part of the rehabilitation of a person, and in the spirit of humanity in medicine, I would like you to see the whole person, not just the voice, but the mind and the soul of the person, and what kind of life they have to deal with. First of all, a few words to how I speak. I now talk about the voice prosthesis is a tiny little tube that connects the esophagus to the trachea, through which I breathe all the time. And when this is occluded by finger or by an automatic valve, which I wear tonight, air is shifted into the esophagus and vibrations are generated, substituting for the vocal cord, and that is creating the ability to speak. So this is how I'm able to speak to you tonight, and hopefully you'll be able to understand me, even though my voice is weak and rusty. A few words about the challenge of cancer, and you as a speech pathologist may meet many patients who had come to you because of head and neck cancer. difficulty in eating, and they may see you for that as well, and weakness, and also burn on the skin. The chronic and lifelong side effects are very, very challenging. Taste may be altered permanently. The saliva is reduced, which leads to dental problems. Their muscles of the neck get stiff, which contributes to their difficulty in speaking. And they also develop swelling in the area of the radiation, and definitely after surgery, because in surgery they also remove the lymph glands that drain the lymphatic. All of those issues make speaking more difficult, swallowing more challenging, and that is also facilitated by neurological damage to the nerves around the head and neck. One of the most important pre-laryngectomy visit is to a speech pathologist, and your job will have to be to prepare the patient to what life is going to be later. You need to explain to them the available speech methods, and I'll talk about them later on. They have to understand that even though they are going to lose their vocal cord, they would still be able to communicate and speak. Second, they'll have to understand that they could do it right away following surgery using an electrical larynx, so they won't be needing to be silent more than just a day or two until the swelling will be a little bit down. What is important for a speech pathologist and the doctors is to understand that the patient needs to hear explanations many times. I know that my set of mind prior to the surgery was focused on the operation. It was focused on getting the cancer out. I did not listen and integrate here is the prosthesis. And here is the prosthesis. Again, before it's inserted. And this is the filter that sits here, clears the air, and keeps the air humid and clean from dust and dirt. And here it's how it's sitting here, functioning in its way. The prosthesis requires cleaning and brushing to stay open, and it takes a lot of maintenance, and it needs to be replaced because it tends to leak over time. And it would also be a great idea to have a laryngectomy, visit the patient before the surgery, to show them that speech is available, is possible, and connect them with a local support group. Speech is just part of the rehabilitation, but you as a speech pathologist can also assist them in eating better. Swallowing disorders is one of your forte, and that will help them to maintain good hydration, nutrition, and deal with swallowing problem and production of sputum, keeping the sputum clean and healthy. Well, even though it's a challenging world, at least in my case, I learned that becoming a laryngectomy and dealing with cancer allowed me to experience life and cherish life in a way I never did before. And I think many patients do appreciate it too. It allows many people to use their setback into a positive way. Many patients volunteer in helping prevent cancer by speaking about smoking, drinking to young people, by helping other fellows laryngectomy. So finding a new meaning to life is one of the ways patients to cope and return to life. And because laryngectomies cannot hide their illness, their handicap, there are many ways simple to society that life can still go on despite cancer, and it's still something that many ways shows to others an example of rehabilitation and a meaningful life. I hope that in my presentation was able to give you an overview of life challenges as a laryngectomy and your role as a speech pathologist. Speech pathology is not only a science, it's also an art that requires understanding and compassion, and you have a great role in contributing to the return of patients to life. I also wanted to make you aware of the 2 books that I wrote on this subject. I understand that my voice is used in the graduate school by the students, and I'm very gratified that my personal experience is helping you to become speech pathologists. And the other book is a newer one, which is basically what to do and how to do, and deal with all medical, psychological, speech issues, and other things that mean to improve the life of a laryngectomy. I have copies of the book, books in the back, and I'll be happy to sign it for you.
your interesting, powerful lecture based on your real life experience. And are you tired after you make long, continuous speech like today?
Yes, I am. And this is because I am speaking to you or anybody requires a lot of training. And I need to maintain low pressure in my esophagus. If I don't do it, I will blow the seal. And blowing the seal makes it more difficult to speak. So I have to constantly economize my words. Even though I've been lecturing for all my life, and even after my laryngectomy, I still go to my speech pathologist twice a week for training. And I go away because even though I'm a seasoned speaker, speaking as a laryngectomy is challenging. And their assistance to me is very, very important. And they're essential to the ability to speak. But yes, it is tiring if I lose my seal, which is about now. It happened over time. But I think today I had a good day. I was able to do it without losing it completely. But every time I come to speak, I spend about 20 minutes gluing it. There is a series of things, a method that I do it. And this is in my blog and also in the laryngectomy guide. You have to go through several stages of using wipes and adhesion and weight and glue and put pressure, and it's all a process that allows me to speak.
This semester I'm teaching anatomy and physiology, and currently we are studying phonation, and my students are there. So, and laryngectomy, and you don't have a larynx, so to produce phonation, the vocal vibration occurs. And in your case, using which part do you make a speech? Esophageal, and which part do you have vibration occur?
I explained to you about the method by which I speak. The vibration is produced by my esophagus because the air gets there. It's like esophageal speech, but instead of burping, the air is coming from the trachea to the esophagus. I'll be happy to show it to you later if you come.
Okay.
I'll take it off and show it to you.
Yeah.
Hey, I've given this talk to many speech pathology classes. At the end of the talk, I take it off, and they all come and look. You're welcome to look.
Thank you so much.
Thank you again for sharing your story with us and your obviously incomparable insight. I'm just curious, when you were learning to remaster a speech, if there were certain speech sounds that gave you a more difficult time in trying to learn them over again.
I did not read Masters of Speech.
You've done a very good job.
No, I didn't read it. But they'll be happy to look at it.
No, I'm sorry, I'm asking, are there certain speech sounds that you had a more challenging time
With
trying to relearn?
age is difficult. I also speak Hebrew, and to produce the head, which is my name, Itzhak, is the more difficult. But the age is the most difficult one.
I was just wondering, you spoke about the other options to regain speech. Did you ever go through a trial and error period where you tried esophageal speech or the electronic larynx?
I tried esophageal speech, and I actually learned a little bit. With Skype, there is a superb speech laryngectomy, and her name is Elizabeth Finch, and she taught me on Skype a little bit esophageal speech, so I can speak a little bit, but it takes a lot more training than I had. I also have an electrolarynx with me, and I keep it in case. I cannot speak, but I rarely use it. It's recommended to carry it with you in case you cannot speak for any reason. I wish my speech pathologist and my surgeon would have allowed me to use an electrolarynx after surgery, because then I could have communicated. Instead, I had to write everything, which was very frustrating, but a good thing. I was able to remember what happened every day in writing my book, because it was there in writing.
Dr. Brook, I thank you also. When I did my graduate program in speech pathology, I had a practicum placement at Manhattan Eye, Ear, and Throat Hospital, and we had a laryngectomy clinic. I think it was every week. And I think I heard that they closed that. I've always wondered, where do people go these days? So I'm wondering, where do people go? Is there some kind of weekly clinic like that? Because I got to see firsthand how much work there was to maintain the puncture and find the right fittings and check for leaks, and it was intense, and I just always wondered, where do people go?
I had my surgery at Beth Israel in New York, and there is a superb speech pathologist there, Jackie, her name is. Jackie taught me a lot of the way to deal with a voice prosthesis, and she has a clinic twice a week, and I think she also has a clinic in Chester County, but I'm sure that they also, Sloan Kettering has a clinic for laryngectomy.
Thank you.
I was struck by you referring to yourself as a laryngectomy, and I was trying, as you were talking about it, to think of other pathologies where people call themselves that. I could think of an amputee, but I couldn't think of any other things, that people don't refer to themselves as a mastectomy. So I was wondering if that had some link to your talking about that it's something you can't hide, and what that means to you.
Some of you may know, but I served in the U.S. Navy for 27 years, and many of my operations were done in Walter Reed, in the Navy Hospital. In that hospital, we see many amputees, unfortunately,
Hi. I was just wondering if you had any particular healthcare providers that were especially empathetic and helpful to you, and how were they?
I was very lucky that I got very, very caring and loving otolaryngologists. And they did a tremendous job in keeping my spirit. And they devoted a lot of time and care to me, and I'm greatly appreciative. Even today, I choose a caring physician who is also competent to a physician who is competent and not caring. And I had to make a choice like this about a year ago when my physician left the hospital and I had to choose a replacement. But I want, and I talk about it in my book, one should not confuse caring with competence. It's great if you have both, but in many cases, because the laryngectomy, the surgery, is not common anymore, very few people around the country are very competent in it. So I think it's important that the patient seeks a place where you find a competent physician that is also caring and loving. And I call it the power of a hug. H-U-G. My H is not so good. And then that's what my otolaryngologist did to me. Every time he saw me, he gave me a hug. And that was so meaningful in helping me recover. And I don't think the hug has to be physical. It can be a psychological hug, showing that you really care. And that means a lot. Not only by a physician, but by speech pathologists too.
This is going to be our last question of the night.
I was just wondering, has being a patient changed the way you work as a doctor since you've had both experiences?
Yes, it did. And I became I was fortunate that I've never had any serious illness until I got throat cancer throughout my medical career. And I never understood what it is to be a patient truly. I think I was always empathetic, but I was never able to put myself truly in the shoes of the patient until I had my saga of dealing with cancer and surgery and losing my voice. And I think I'm a better listener and better compassionate physician today than I used to be before. And one of my proudest moment was that one of the physicians that took care of me and was not as compassionate as he should have been. After reading the book, wrote to me and called me to tell me that he has changed and he is now understanding better what patients go through. And he doesn't hug them physically, but he gives them a psychological
Thank you so much.